Walgreens is a $75 billion company. It has 8,200 pharmacies across the United States, and all of its pharmacies are located within 3 miles of 66% of the American population. It has 6.2 million customers visit its stores daily. 6.2 million customers. In terms of specialty pharmacy, it's number 3 in the industry. It has 850 specialized pharmacy facilities that do all of the specialty high-end drugs. It's the largest provider of infusion services in the United States. It has 200 outpatient pharmacies in hospitals across the United States. It has a company that it calls Well Transitions that helps to improve adherence and reduce hospital readmissions. It has 400 retail clinics at Walgreens in 21 states. It has 1,800 nurse practitioners and PAs, and every clinic has a collaborating physician. It has 350 worksite health centers and 160 employer clients in 45 states. It has 81 million individual users of its website. And in its loyalty program, and I still can't get over this, there's 105 million people signed up for the Walgreens loyalty program, which means that every time one of those people walks into a Walgreens store, Walgreens knows exactly what they bought, when they were in the store, whether they came in for a pharmacy, if they did they buy other things while they were in there. This whole thing adds up and they understand the data relationships in terms of running their business. So basically what Walgreens is really trying to do at this point is, everybody's sort of hung up on the retail clinics, and that's something to be seriously hung up on because there's no doubt that they're taking business from your outpatient clinics and your emergency rooms. But Walgreens wants to be that healthcare company. And so does CVS. When CVS announced its reorganization, it actually said in the press release, it used the words healthcare company. When they decided to stop offering cigarettes, they said that the sale of tobacco products in CVS stores was not consistent with our mission as a healthcare company. That's a quote. Not a paraphrase, that's a quote. There's only one problem about the way this competitive development is going. And that is that they don't want to be the healthcare company that you want to be. They want to understand that there's a level of services that they can provide up to a particular cost threshold. And once they cross that cost threshold, they want to leave all the rest of those services at that cost point to you. So in other words, if you want to look at your services on a layered basis, you have tertiary and quaternary care, then you have secondary and inpatient services, and that's your inpatient work. And then you drop down to your emergency room, and then you drop down to your outpatient centers, and then you drop down to any other services you have below your outpatient centers. So all the costs obviously are stuffed up in the hospital, mostly in the tertiary and quaternary, but maybe very much to a great extent in the high secondary levels. And Walgreens and CVS don't want to go there. What they want to do is strip out the layers of service that are below a particular cost threshold that can be treated at a particular price point at a particular level of profitability. And this is basically where, if you want to go take a close look, most of your contribution margin is in all of your hospitals, of all of you who are currently sitting in this room.